This is a little bit technical, but really what it says is that the type of treatment that we had then was not so terribly different from how it is today, except it was much less automated and much more patient, much more technician and nurse dependent than it is today. So, but it nevertheless, quite quickly after 6 weeks, I felt much more active. And Dr. Scribner, being a very energetic, charismatic doctor, a bit like our leader here, Dr. George Abraham, said, well, don't sit around, Robin, you should come and join the ward round. There's no need for you to, you know, you're much better now. You've got to be positive. And he made me follow him around when he was teaching the other students in America. And that was a wonderful example of how not to be a sorrowful patient, but to get up and try and do something. And I thank him for that as well. Next slide, please. Of course, even in 1963, the American press were interested in this young Englishman who had come to receive treatment in America and learn to use this complicated machinery, not just for himself, but for the other patients. So it was interesting to do further press conferences today because it does seem that the public do need to know about dialysis treatment and how it can affect people who need it. Next, please. As a medical student, I try to be a little bit scientific about following my own progress, so I don't want to dazzle you with this chart, but one of the amazing effects of the early stages of the treatment was that my blood pressure started to come down from being a very high level of 180 over 130 within a few weeks, and over these years the blood pressure came right down to 120 over 70 with sodium restriction and dialysis. That was the message, which I have to say that my specialists in England in the very early days, even the best specialists had overlooked to some degree. They did not realize the importance of sodium restriction in people like myself. Next, please. So this was Seattle, Washington, as it was then. Next, please. And then part of the arrangement was that I could only stay in Seattle for 4 months. So in June 1963, my parents who were with me at the time, my father had retired, and they very kindly took me to Seattle. We all moved up to Edmonton in Canada. Next, please. And there I continued to receive dialysis in these days. I worked as a technician in a kidney unit, and there were some minor improvements in how we did dialysis. In the beginning, all the fluids going through the kidney machine were refrigerated to keep the bacterial count low, and then we started using it at warmed pressure, warmed up, which gave a more efficient dialysis. And still overnight, so we had dialysis overnight twice a week in this unit in Edmonton. And we didn't have the modern day fistulas, we had to have tubes inserted into blood vessels in the arms, known as cannulas. Next, please. Edmonton is a prairie, in a prairie province of Alberta. There's snow on the ground for at least 6 months in the year. So it's quite different from Chennai, but sadly not so different from England, as we have had a particularly cold winter in London in the last few months. Next, please. And so eventually 2 centres opened in London, and my parents and I were able to move from Edmonton right over the pole again, coming back to London at the end of 1964. Next, please. And I became a patient of Dr. Stanley Sholden at the Royal Free Hospital. He was a pioneer of dialysis. A very, very active man. He believed in getting good results in quite an aggressive manner, but a very effective way. And he also promoted the notion of self-dialysis, that patients shouldn't just be passive during the treatment. They should take an active part in taking some of the measurements themselves, the readings, looking at the blood going around the circuit, making sure it's all right. Of course, there would be nurses overseeing the whole procedure, but it was important that patients should have some knowledge and take some responsibility themselves. And I think that was a very important idea, because it's what we should all do in life, whether we're patients or not. Also, there was no blood transfusion. Blood transfusions have been responsible for causing quite serious problems with hepatitis and so on. So he wanted no blood transfusions, so we became extremely anemic. But nevertheless, the human body, when you're quite young, can adapt itself remarkably well. And I was able to do my work as a junior doctor with blood hemoglobin, that's the material which carries oxygen around the body, of half the normal amount for a man, and the work a 12-hour day when necessary. Of course, I was very tired at the end of the time, but it's amazing what you can do if you really have to do it. Next, please. This was the state-of-the-art kidney dialysis supply system in the Royal Free Hospital in 1964. It was simply a tank which had been taken from a photographic laboratory where they made these tanks, graduated tanks, filled up with water from an old geyser you see here, a few monitors, chemicals let in and mixed with a canoe paddle to make sure that it was an adequate mixture. And from this tank you could have about 8 to 10 patients treated at the same time. So this was high-tech in 1964. Anne and I visited the very excellent dialysis unit in Chennai today and could see that you've got the latest equipment thanks to your sponsors. So the patients really are very fortunate in having the best treatment here, not just with the technology, but with the wonderful nursing as well. Next, please. And here I am as a young man again. This was a press photo. They were doing an article in 1965, and this was the kidney in those days. It wasn't a simple coil tubing that you have today. It was flat plates known as a keel dialyzer, and these are the membranes between these plates where the blood gets. These were the filtering membranes. And this had to be stripped down and cleaned after each dialysis for the next patient. It was a very big operation to do that. This patient is myself at a younger age, trying to keep an eye on how things were working. Next, please. And you had to have tubes in the arm. These things that look a bit like faucets, actually, able to separate one tube from another and then hook yourself up. And it wasn't just because I had some medical knowledge that I could do this. This was common practice among all those patients in those days. They could hook themselves up on the machine with the nurses watching if necessary. Next, please. There was an evening newspaper which doesn't exist anymore called the Evening News in London, and they took this photograph of all the patients at the Royal Free Hospital in 1964, and they called us the Lucky 13 as we were all able to receive treatment. This is Dr. Sholden. Here, he's still going strong. He's 79 years old now, and in those days I had a liking for three-piece suits, but I don't wear them very often. But the sad news is that all my fellow patients from those days died a long time ago, so I've been very fortunate to be here today. Next, please. So the next big stage was to Marianne, who's with us today, who's my dialysis nurse. In fact, I read her palm one day when I was receiving treatment, and I said, "You have a very interesting palm. Did you know you were going to meet an extremely fascinating man?" And then I asked her out on our first date. The next thing was that we got married and we started the machine treatment at home, which was encouraged in those days, so we could look after our own dialysis. We could time it according to our own needs, and we could both get on with our own work. Next, please. And this was a machine I had then in the bed at home in a room in our house with a water softener. Next, please. And we had to build these machines, these kidneys ourselves. These took quite a lot of time and put quite a lot of stress on our marriage at times, and a lot of other couples having to do this, I have to say. Next, please. So, of course, all this, looking back on it, I try and remember the happier side of what went on, but of course there were awful problems as well in those early days, and I've listed some of them here, and I don't think I need to go through the list, but it's extraordinary that one could have such severe problems, which some of them technical, some of them bad infections, some of others, and then come through it. And I would often meet other patients who had had a bad dialysis as well, because in those days it was much easier for things to go wrong than today. And we would feel terrible for a day or two, and then we could sort of laugh it off to some degree. That's how we sort of managed. And I suppose we were all quite young too, and we sort of looked at back and thought we were sort of rather like young soldiers in a battle in the front line. And there's extraordinary camaraderie among soldiers in the front line, even though they may be going through awful, perilous, potentially perilous times. And I think it was a bit like that, actually, in some respects. Next, please. Anyway, there were problems, and we managed to find solutions. And I was very impressed seeing in your dialysis center today that all your water is treated by reverse osmosis. This was certainly not the case in the UK until I had actually had this water treatment during a visit to the USA, which helped me very much because I was getting terrible high temperatures and chills from problems with the water. And then when I managed to get a reverse osmosis unit in my house, everything changed and I felt much better. And also, we had a more limited reuse of dialyzers, which helped to cut down on the reactions I had after using the dialyzers many times. Next, please. And then in later complications, there was bone problems, and this is a problem where the nerve into the wrist gets trapped, causing problems with the hand musculature called carpal tunnel syndrome. Nearly all patients on long-term dialysis get a very severe shoulder pain and other problems, which I was on for 20 years, and I would hope not many patients would have to endure for 20 years before having a transplant. Next, please. But we had solutions, and some of the most important solution for me was having a transplant, which I'll talk a bit about later. Next, please. I've always been very keen to keep up my traveling, and when I had to dialyze, I managed to go to, usually through, when I was attending conferences, to many different centers in 15 countries, including, actually this was a holiday in Hawaii. I didn't go there for a conference. But I did have a dialysis in the Tokyo Ladies Hospital, and it was quite a challenge because I had 2 dialyses there. And in Japan then, unlike in India now, or India then, nobody spoke one word of English, so we had to communicate totally by sign language. And since Japan is well known for its high-tech engineering, after getting through the usual formalities of nodding to my doctor, my nurse, they then showed me a range of 6 different machines and said, indicated, would I pick one? But I really thought, well, very kind, but how do I pick one out of the 6? Anyway, nevertheless, I had 2 excellent treatments in Japan without exchanging one word that they understood or I understood. So that's possible. Next, please. Travel has also been very important to me, and one of the places that I go to went to and had a very good dialysis is in the island of Sicily. And it also taught me a great deal in that when I had hemodialysis there, they were starting in the bed next to me, a lady who was in her 80s. And I said, that's amazing. In the 1980s when I went there, this lady would never be offered treatment in the UK. Because in fact there was a cut-off age in the UK of 65, which I am now more than. I'm now 69. And they said, no, why should they cut off an age? She has grandchildren. Why shouldn't she have some more time to enjoy her grandchildren? Absolutely right. And it's quite wrong for people to make rules based on age if a patient can benefit. And so I think I learned a lot from going to Italy and seeing how they did things. Next, please. Family life. Very important. So our son Tom, who's adopted, came along in 1978, 10 years after we got married. And there's Anne. And our son, of course, got used to Daddy being on dialysis at home. And he didn't quite work as my personal assistant, but he was very curious about the blood whizzing around the dialysis machines. Next, please. So everything changed when I managed to have a transplant performed by Professor Peter Morris in Oxford, having been told that I would probably never have a transplant because I had so many antibodies. Antibodies are sort of chemicals in the blood which cause rejection. And since I'd had so many blood transfusions from so many different donors, because each blood transfusion is like a little organ or tissue transplantation, I had mounted a lot of antibodies, which would mean that I would much more readily reject a kidney from another person. But luckily for me, Professor Morris was not only a brilliant surgeon and the Nuffield Professor of Surgery in Oxford, and he's an Australian, but he'd also done a PhD in immunology. So he had a very good understanding of what was going on with the rejection process. And he was able to find a kidney for me, which is here, which I have today. And it's a kidney from a young woman, of course. I never met her, naturally, because sadly she had died, enabling me to have one of her kidneys. But it was through the generosity of herself and her family that I'm here today. And I think that deceased or cadaveric kidney transplantation is enormously important. And I think that that is one thing which needs much more press, much more public awareness and information of how important it is for most kidney patients who will not have, like me, a suitable living relation. There are one or two downsides of treatment in that you have to take strong medicines, especially at the beginning. I got a depression with steroid effects, and I had a type of lymphatic cancer which came on 8 years ago, but fortunately was cured quite readily. So those are small problems which we've dealt with. But the plus side easily outweighed the negative side. Next, please. So what about weighing up transplantation and dialysis? There's no comparison if the transplant is working well. But dialysis is not a terrible condemnation to near death, as some people might think. Actually, you can have a pretty good life as a dialysis patient, but you really need to be able to look forward also to having a functioning kidney transplant one day. Next, please. So, how does one cope? Being a doctor, has that really helped me, or do I know too much about problems? That's another thing. It's not easy being a doctor and a patient sometimes. I deliberately didn't want to become a kidney specialist because I didn't want to be too close to my lifeline and my work. And all doctors are very anxious that they don't want seen to be ill because they need to feel they're pulling their weight. So I try to do that. Home life, incredibly important to me, and Anne has been an enormous supporter. very fortunate. And my interests in foreign travel and other things have been important as well. So one has to keep that up, and I think it's important to stress that all kidney patients should be active and take some sort of regular exercise if they can. Next, please. So how does one cope? People who try and sell properties to you, whether it's a flat or will say location is awfully important. And I think if you're a kidney patient, there are three things which I want to stress, and they're all the same. Attention to detail, attention to detail, attention to detail. Your health comes first, and unfortunately, in order to be successful, you must be selfish. You have to think of yourself, not in a miserable way, but you have to make sure that you don't forget the details. Thank you. Next one. So, what about my 42nd years of coping with renal replacement therapy? Consult the best medical team. You've got a wonderful medical team here in Chennai, and I know in other parts of India. And they're there for patients to consult, and families, because families are involved as well, not just patients. If you're lucky enough, like me, to have good family backup, there's nothing that can substitute for that. You must keep your blood pressure as normal as possible, and you must never skimp on the treatment.